Medicaid expansion. Let's get an update on this. A report from the Independent Fiscal Office says it's determined an expansion of Medicaid would result in more federal spending here in PA and less spending needed by the state. So, positives on both ends there, according to that report. Since we last met, you also had your face-to-face with the HHS secretary. So are you still in your mind dead set against this expansion?
Well, what I said back in February is I couldn't recommend it at that time, but I have kept an open mind. I did meet with Secretary Sebelius. We met briefly. Our staffs met for a longer period of time. The two, her staff, my staff, are still in discussions. We have a number of questions, but let's go back to the very core basic. Number one, I believe, and my goal is to bring quality, affordable health care to Pennsylvania that is sustainable over the years. And I do mean years. What I see is a rush to take the money now, forget about the future. And that's exactly what's happened in the past and put us, in many cases, in the positions that we're in right now, in many issues on the economy. I tell people, I have a grandson now who's 19 months. And I want him to have a state that's in a better economic shape when he turns 21 and goes out into the workforce than the basic foundation that we have right now, without all the commitments that have been made by prior generations to spend the money and worry about the future. And that's frankly what I see with all the talk about it's free money, take the money now, don't worry about the future. That's where I'm different than many of the people that are out there on this. But we continue to take a look at it. We have some very technical things that are not easy to explain. We tax in Pennsylvania. We have a gross receipts tax on the hospitals. We tax them, we get the money, we get it matched from Washington, and then it goes back to the hospitals. It's kind of a,
shell game is what you were about to say, isn't it? Yeah.
I keep calling it a shell. It is moving numbers from one side to the other to the back, and that might go away. If that goes away, then the money that IFO is talking about, they haven't even considered that in this. This is much more complicated. But what else I'm seeing, and you probably have seen the articles that continue to come out almost on a weekly basis of, there was another tax in the Affordable Care Act that nobody was talking about. That's adding to the cost. You're seeing where businesses are deciding to reduce the number of hours of employees so that they don't have to count them as full-time employees, so that they don't have to provide them health care. Now, I don't think that that's exactly what the Affordable Health Care Act envisioned, but the way it was set up, that's what it's causing. It's taking people off the rolls.
I don't think that's necessarily a new tactic for some businesses, though.
No,
I've experienced that in my career, quite frankly.
But it
not
is,
here.
But it is growing. I mean, remember, I think what's the magic number? 50. All of a sudden, you're in another area. There were some companies. I know a restaurant chain in this area months ago said to me, we're going to keep our number under 50. We're not going to expand. I'm not going to buy another restaurant because it would take me over that magic number. So we're discouraging that economic growth.
All these uncertainties you're talking about, though, Governor, of things that may happen to be the proverbial punch in the Pennsylvania economic gut, would they not be happening no matter which decision you made on Medicaid? And so you might as well take the investment, take the money now?
No, I mean, I don't agree with that because we don't know exactly where we are with the Affordable Health Care Act. We have asked for reforms. We haven't gotten a direct response on that yet. And I'm not going to go into the details of the reforms right now, but we think there's some reforms that could be done that could make this more palatable. We haven't heard that. But again, I'm going back. They are spending the money up front and really putting the debt on the back of our children and grandchildren.